Let me share this live. Let's share this. I'll be back. Good evening, everybody. Good evening. Welcome. 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 Let's see if I can put this like this. How are you? Welcome, everyone. Come on in, come on in, come on in, come on in. Let's do some education. 33, 8, 33, 33, intuitive. How are you? Let's do a little bit of education here. Let me educate you on some things. Come on, everybody. Come on. Don't go anywhere. Don't go anywhere. Let's spend the night together. Happy Friday. It's Friday night. Instead of going to the club, let's do it here. Let's stay here. Let's have some fun. Guys, go ahead and drop in the chat. I want it to be very interactive. I want to take your question. I want to see if you have anything pertaining to what I'm about to discuss, or if you have been following me and you have questions for me, just go ahead and put in the chat. Let's rub minds together. Hey Alice, good evening, my friend. How are you, Miss Mikawan? I can't pronounce names. I'm sorry. Alice, how are you? Good evening. Welcome. Welcome. Sorry, Alice. I messed up your last name. So if you look at the thumbnail that I posted, what did I put? Let me see if I can read out the thumbnail. I can't remember what it is verbatim, but let me see if I can pull it up for you. Let's talk about government contracts a little bit. Some of you don't know that you can leverage, right? So how you can convert government fund into a consistent daily revenue. Do you know that that is a possibility? Some of you don't know, right? Some of you, the way that you see government funds or contracts, well, we all see things differently, right? We all see things differently. But oh, thank you, Miss Alice. But when I talk to some folks, they will say, yeah, I'm working on my government, I'm working on my cage number, my SAMS.gov website, my SAMS.gov account, this and that, right? But it's a new approach. You have to see government fund differently, right? And you would only know what you know with the type of information that you know, right? You only know what you know based on the type of information that you have. Okay, so in 2025, guys, you really do have to know that you have to put your business. Hey, love, how are you, Natasha? You have to put your business. You have to sow your business in a very what is it? Fertile soil, right? Fertile. A lot of us work hard, but we don't work smart. We work hard, we don't work smart. And in 2025, we need to change our mindsets. So, as from 2025, I want you guys to start to. Oh my gosh, I need to remove some people. That's it. Okay, great. We need to change our mindsets. I already did. Yeah, they about to distract me, so I deleted him. I think I think they are bots. I don't think they are normal human being, honestly. But that's by the way. Let's get on track, guys. Please, let's concentrate. There's a reason why I'm here. I'm not sleeping, right? Because I want to just educate us. I want to provide some type of education around government funds and the way that we see government funds. It's different, and I want to start to help us to think in the right channel. A lot of us think government fund. How do you even think you can bid for contracts on SAMS.gov? That's huge. You know what I mean? And most likely you probably would not even get it. So The best way to seek for government funds are in different ways, right? You can probably start with your state level, right? You can do it from your state level. And that's what everybody should be doing. As an LLC owner, as a business owner, you need to apply or sign up your business through your state. For Maryland, it's called EMA, and I know every state have their own thing. You will sign up as a vendor, and once you're signing up, you will have a ton of list of departments or specialty. So you will carefully select what you are able to offer. And by the time you do that, when they start to send all of those procurement RFPs, you will be able to see what you can apply, what you qualify for. So you'll be getting real life or real time updates on what you truly qualify for. So everything coming into your email are the things that you're able to do, right? Are the things that you're able to offer in your business. In other words, funds are available for business owners. I this from the platform. Okay. Funds are available for business owners. Um, but you guys don't tap into those money. You guys don't tap into it because y'all don't think it is possible. I have won several government contracts. And anytime that I bid, and when they start to call us for meetings and all that, it's only maybe just myself and one other agency. A lot of people don't look into those places. I don't know. One, it's a complex process in your mind. It's hard. I can't get it. I don't know how to do it. I'm not ready. What they're asking for. Let me tell you something. Those things are generic. Those things are generic. And the leaders are always looking for businesses to help them. Let's start with STD, for example. Your business can cater to STD testing, right? You guys have clear, you have your clear, you have your everything, you have your diagnostic lab. We are the appropriate business to do STD testing because that's what we do. We do collection, we do point of care testing. And I don't know if you know that STD test or STD is a general public health problem. A lot of people that have STD transmit the disease, and that's how it spreads and spread and spread and spread and spread. And it affects the whole population, right? So from that perspective, that becomes what? A government problem. And it starts with one. And the moment one person has that, nobody is safe. It's like COVID. Why did you think they were paying people back then? Why do you think people were cashing out of ARSA? I don't know if you guys know ARSA about ARSA. Some people were making millions of dollars as of 2022. That's actually how and what make this industry popular today. A lot of us were not into this business. We don't know that we could do it. You only know what you know. If you are in this lane, you won't know what's on the other side because you have not walked that path before. That's not your lane. You would not know because you have not been in that situation. So you don't know unless you are introduced to that path. So let's go back to where we were starting from because I have to help you understand the bigger picture. The moment you understand the big picture, you understand that you're in the right place and you're in the place at the right time. So government fund is where we want to tap into when it comes to 2025 and on and on and on. So there is what government does is that they always, what is contract? Why are they saying come and do this work? It's work. So they are looking for you to get it done. And they're looking for who qualifies to do that. So with this new initiative, we would make sure that your business qualifies for what we are bidding for or what you're applying for. Because what makes you don't get the bid or the contract is that you don't qualify. So these are the things that experts are going to help you to accomplish. They would make sure that your business is getting ready to be successful. We'll put everything in place to make sure that by the time you submit your proposal, by the time you do all the things and you submit those requirements, you are ready. They won't have any choice but to give it to you because why? These people are called experts. They have been doing this day and night and they've had a lot of success stories. A lot of businesses have been funded through the program. I don't know if it's making sense. So everything that would not make your business qualify, it's on paper. We already know what the problem, what can be the issue, what the issue can be. So we would make sure your proposal is this, you have that. They will prepare you. It's like you want to go and do your nursing examination board. Why won't you pass when you have studied? So they will make sure your business is ready. So by the time you start to apply, there is no way you're going to miss it. And it is true a body. It's called collaboration and contract. And I keep saying that. But I will keep coming just to educate you guys. So governments are always, the funds are always untapped. A lot of businesses don't link into that. You know where we look into? The moment we get into business, the way that we are trained, the way they wire the situation, the way they wire is that get LLC, get business credit, get bank account, get flyer, get marketing, get website, get certificates, then start to run helter skelter, start to look for clients. And then by the time you start to run and run and run and run and run without strategy, without ideas, without proven method, you get burned out. It becomes uninteresting because you're not making money from your effort. You try month one, the second month, the third month, no results. How are you gonna continue? How are you gonna continue with the passion? Go and drink water downstairs. It's silly. How are you gonna continue? How because you're not seeing result. There is no results in what you're doing. Because one, you are operating by yourself. You don't have formula. There is no strategy. You don't have a team. And you're doing too much at the same time. So what I am trying to say in other words is you're going to tap into government funds. So let me continue to define government for you in a minute so that it will make sense. So the government bodies are always like, and it depends on what you're doing. But I'm going to try to tie it back into what we do here. We do testing. Let's use lead as a case study. Let's use lead as a case study. Let's use A1C, glucose, and cholesterol as a case study. What else do people test for? Let's use all these other diseases as a case study. Why lead? Why STD? Why all these public health topics? Why cancer? Why this? Why that? It's because people are dying from it. And we have to either stop the spread. It's about prevention. It's about education. It's about testing. That's the healthcare. That's where you fit in. Why are doctors here? Why are they treating? Why are they diagnosing? People are dying. People are sick. Sometimes prevention is better than cure. All the job of a doctor is to cure. Doctors don't prevent. Our job is to prevent. How do we prevent? Early screening, early diagnosis. Why do they ask you to go and get your mammogram? Why are they asking you to go and do testing, routine testing? Why are they asking you to do your physical every year? Why are they asking you to get flu shots? Why are they asking you to do all these things? It's to prevent is better than to cure. So that's why you need to understand the power of what you're doing, your tool, which is your business. By the time you see your business as a tool, as a solution, you begin to understand and you begin to capture the right people and you begin to get the right money. Because you have to serve first, then the money will come. But a lot of us don't understand this concept. So let's go back to lead. Lead is poisonous, and children are at risk because they are the ones that they put everything in their mouth. And lead can be found on so many surfaces. So that is why it is a mandatory test. Thank you, Gordon. That is why it is a mandatory test and to capture them. It's just like your vaccine. Why are they making vaccination mandatory? Because people can die from measles. People can die from tetanus. People can die from polio. That's the reason for all of these things. The moment you start to see the power of your business, you will start to make the money. But some of you see this business as, oh, my girlfriend is doing it. Oh, my daughter-in-law is doing it. Oh, Coachella is saying it. You don't even understand what I'm asking you to see. You just see the numbers. You don't even see you only see the numbers. And it's going to become hard for you to get to the numbers because you don't even understand the basic. So your business is an asset. Your business is helping the government, is helping the people, is providing solution to healthcare system. You are testing. A doctor don't do anything unless he see a test result, unless he sees a lab report. So the moment you start to see that you are part of the system, you are a solution provider. Children are exposed. They are we call them high risk. They are at risk for lead. That's why we capture them before they turn two. Because if they go undiagnosed, it can lead to what? Autism, all this other developmental disability. So that's why they have to capture this testing and screening. It's called screening testing services to help all these problems, right? And that's why every insurance company, because guess what? Doctors don't test. That's not their job. A doctor don't test. They are not labs. Doctors are not laboratory. That's why there is always fund available to labs to help them in carrying out this process, to help them to test. That's the reason why I was able to get my contract, my money that was funded to me to do this testing. Is it making sense? So we are going to turn government money into daily revenue. I am not saying there is anything wrong with you marketing, doing all the other traditional things. But if you want to level, if you want to work hard, if you don't want to be burned out, if you want to truly make a six figure out of this industry, that's how you're going to approach it. That's how you're going to approach this industry. Because the funds are there, but it's untapped. Y'all don't go there. Y'all don't use them. Y'all don't know about it. You are trained in the traditional way. You don't understand all the other things that are available to you. Okay, so we want to start to talk about. Oh no, that's it. True. I'm honest with you, Gordon. That's the fact, and I can go on and on and on and on and on. Look, what about STD? Undiagnosed STD. People will just continue to transmit. You're gonna sleep with somebody now. You are exposing your life to STD, whatever HIV, whatever the thing is. You know how many people have HIV undiagnosed? Because people are not first educated and they don't understand that they need to do testing. So the moment you start to sell your STD testing, don't you think you're going to sell out? Especially if you're offering mobile testing, because that's what they need. A lot of people don't feel comfortable to go to their doctor for screening. They don't want to go to the doctor to talk about their issues because it's symptoms. Some people don't even, sometimes some symptoms are silent. They don't even know they have these diseases. So you would take your business to them, and by the time and what is grant? You can get grants by what you're doing, by asking for advocating for what you're doing. And this is what this new initiative is all about, because I truly don't know too much about it. But my newest contact, that's what they do. And there's a lot of success stories around these things, around what they are doing, around what they are catering to. So I want us to start to fashion, guys, in addition to what you're doing, in addition to your traditional way of getting clients and making money in this industry, you're also going to tap into government funds. You're going to apply your business. They would help you to do what you need to do. Your proposal, all the certifications, whatever you need to be successful to get these funds is what they would help you to accomplish. That's what we're going to do in 2025. That's what we're going to do in 2025, guys. That's what we're going to do in 2025. For right now, I'm not going to announce yet, but my business, I'm part of, they've been shortlisted. And right now we're ranking as the highest, like we are the most qualified. Hey caller, how are you? We are the most qualified right now. And it's all through this strategy that I'm sharing with you. But I'm going to share my blueprint, of course, step by step on how I got all of this, And it's untapped because people don't know. They don't go there. It's not their language. They don't understand it, so they can't even execute it, right? So if anyone have any question, you let me know. I'm just here. I don't intend to spend too much time. Thank you, Miss Alice. You for some of you, I don't know if you have enough or tangible excuse not to be at the conference, but this is where I intend to give you the blueprint. This is where I intend to give you the blueprint. My guest, my keynote speaker. I have four keynote speakers. One is the government, is the lady that's going to teach us exactly about this government contract. As we speak right now, there is $1 billion in funds that is readily available in healthcare and lab that we are not looking at. Every year, I don't know if you guys know about the MCOs, the Managed Care Organization. They set aside money, and what they do is cater, use it for community outreach. Community outreach in this, and that's actually how I got my funds. That's how I got my contract. MCOs will set money every year aside to help their members. I don't know if you guys always receive text messages from your insurance company about routine tests. Sometimes they can send you messages about pap smear. They can send you messages about cervical cancer. They can send us messages about, oh, have you gone to do your flu shots? You know, they send those reminders, right? These are the monies available. These are the things that they set the money aside to do. That's what Medicaid or your insurance should be doing to you. That's what they do. And you guys don't know about this money there because nobody's teaching us. There is no coach out there that is talking about this money. What all the coaches we have in this industry are just fixated on certificates. They think it's about the certificate. That's why a lot of people come in the industry and they fail and they leave the industry because they are always fixed on teaching people, oh, DOT certificate is just, we call it jargons. I call it jargons. There is no success in those mechanisms, in those method of teaching. And that's why I am taking it upon myself in this industry to take us to our next level. That's why I'm doing this thing that I'm doing. It's 10 a.m. I'm not sleeping. I don't need money. Today already, I've accomplished my goal. I've made my money, and that's the way I've set up my business for the rest of my life. I can't go poor because every day I make money. Every day I make money. I've done it to this in a point whereby even in my sleep I make money. I don't have to wake up and be struggling for money again. That's why I'm able to come here and teach you guys the way. I don't need money because every day I make money. I don't have to. I don't do no. And it's because I have invested in myself. I have decided to network with the right people. I have decided to sacrifice a lot of things. Now I can brag about what I have through hard work. It's not about brag to make some people feel less or high. It's about true hard work. And I'm coming here to empower you that if I did it, you can do the same. That's what I'm teaching. I'm not teaching you that I am better than you. That's not what I'm saying. I am saying that as a coach, I need to educate you to change your mindset. The industry is not about certificate because that's the pattern. Everybody running into this system thinking they can teach, they can teach, they can teach. They are just giving you certificate. Then what do you do with the certificate? Put it in your wallet. Don't do anything with it. You don't have strategy to make money. I have, and my contract will continue to renew because there is nobody even looking at these things. There is untapped resources. Is untapped into. And I already gave you a little bit of idea how you can see healthcare system. That's the way healthcare system works. Why are you testing? Why are you called a lab? What is the purpose of testing human being? Why are you getting their blood? Are you supposed to drink the blood? The blood is for us to diagnose what the problem is. People have problem. People are unhealthy. People are dying. People are sick. So they need to get well. And in order for us to get well, we have to get in their, it's about health. That's why it's called health care. And lab is a huge portion of healthcare. And you are not even asking for the big portion. You're just asking to take out of the just a bit out of the portion of the healthcare as small business owner. And the best way for you to do is put your business in the front of the leaders that are looking for what you have. That's what I'm trying to explain to you. I hope you guys are understanding where I'm coming from. So it's part of the healthcare system that you guys are not tapping into. And they need you guys every time. They need you. And most of you offer mobile services. You guys are mobile labs. Do you think Quest has time to do mobile? Nobody. That's how we play. That's how we come into the system. That's exactly the fraction. That's that tiny fraction. That's where we fit in the puzzle because we are mobile labs. Quest don't do mobile. They don't have that. That's not the way Quest is designed. So you guys are mobile and you can do the community outreach. You're always available to go in the community all the time. Mobile, that's what that means. But when you come to conference, you will begin to you that's where the education. I can't educate you here. I mean, how many minutes am I going to spend here? That's why you have to invest in what will transpire and transform your life, your business, where you can use accurate real life results. The conference is not designed for motivation or to just take you from your home and waste your time. It is to add value to what you're doing. It's to add value to your business. It's to take your business to the next level. I can't teach you. That's why we have to come in a common space and in such a place like business conference that you can invest. And these things can even be write off. Next year, you're going to file tax. Even before next year, you're already going to be making your money because you're walking away with your head up high with everything that you need. Solution in your pamphlet, in your hand like this. We can't teach you from home. We can't. I can't. You have to be in a common space for you to network. Come and learn about the untapped money, the resources, the funds available to labs, specifically in diagnostic lab. I'm going to show you exactly how you can get your own lead testing contract in your state. Every state is available there. It's not only in Maryland, it's available in your state, but nobody knows about this. It is in that conference that I'm going to share all of this information. It's in the conference that I will show you exactly how you can do it step by step, how you should go about it. I'm going to tell you right now, if you don't have NPI, if you don't have CLEAR, make sure you have those two things before you come to lab, before you come to conference. You need to go and get your CLEAR. And I'll give you the rest of the formula when you come there. I will share it with you exactly what you will be doing, how you would, the verbiage, the script, the people, where to look to exactly there. By the time you put it, you unlock it. I'm just giving you the keys. You're just going to go back home and turn it and unlock it. It's at the conference. I can't unlock it here for you. It's illegal. I can't be talking about all these things here. You have to be in the common space to learn about all these things. Make sure you only want to get the piece, one piece. Okay, at least make sure you get your CLEAR. Make sure you have your CLEAR. That's the point of care testing certificates from your state, from CMS, Center for Medicaid and Medicare Services. You need your CLEAR and you need your NPI. Then I will show you how you can get your own funds. Those community funds for lead testing in your state. Not just lead. That's what I'm sharing. My guest speaker will show us exactly about the $1 billion available. How your business is. It's not cage, it's not sams.gov. Don't let anyone take your money and just give you motivation speech around government contract. That's not what we're going to do at the conference. It's not going to be motivation speech for government contract. We're taking it to the next level. You will come, your businesses will be signed on in the collaboration. We call it collaboration. It's a collab in government funds. How you can tap into the resources and getting you guys' business ready for success. Okay? On top of that, although we don't have any more VIP tickets to sell, I'm not selling tickets for VIP anymore. I don't have that right now. That's why you can easily invest in the early bird tickets for just general session. As long as you're in the room, you're not going to miss anything. You're in the room, you will have access to all the information. The only difference is that with the VIP tickets, they have just few advantage over that, and that's why they paid more. And that's why I don't want to take away from the beauty of the conference. It's not only for VIPs, it's for everybody. The VIPs are subcontractors. They will be able to have access to my lead testing money. They will have access to my lead testing money. My money is 3.8 billion untapped. I don't do it. You can have Natasha. Natasha is right here online watching me right now. Our first list that they gave us was 800 kids. 800 kids. 800 kids. Just one cohort, and we are just starting. You imagine if we're able to knock that 800 in 1 month. That's how much we can make. And we keep doing that. We keep knocking it off, knocking it off, knocking it off. And the only reason why we have 800 is because these babies are turning two. We need to really, really capture them because some of them are turning two tomorrow. Now we are missing money on those because we can't, once they turn two, we can't see them. And they're also getting incentive. That's to say, I'm going to, it's a lot behind the scene that you don't know. I'm glad you said something, Natasha, because it's not good to lie. I'm not about lying to people I don't lie to people to make it. That's not what I do. So y'all need to be there to come and learn about what you should be doing and not wasting your time on internet and paying people that would not add value to you. It's a lot of you that have paid for a certificate because it sounds good, but they don't give you the formula to use your certificate. Yes, AABB certificate. My internet and my phone has been is y'all have been calling me just because of this AABB certificate. A majority of you don't even know what AABB certification does or what it means. I took my time a minute to explain what AABB is. AABB accreditation certificate is only available to you if you want to offer. No, it's the fact. No, I don't know. It's the fact. If you want to offer immigration DNA only. And that's why when you reach out to every lab, they don't talk about it because they don't want you to tap into the immigration money. They don't want you to do immigration because there is money in it. So they make it. So what they do is politics. They monopolize it. They don't want it to be available to you and I. They don't want to make it available to you. So, for example, when you reach out to DDC, Universal, all these other AABB labs that are accredited, they only give you the access to sell all the other DNA, like ancestry, paternity, legal DNA. But they won't let you sell immigration DNA. They will rather ask you to refer your clients to them and they will pay you agent fee, referral fee. But when you have the power to sell, you know how much you can sell one immigration DNA? It's from 600 to 1,000. Typically, I charge 1,000, but when I teach my student, I ask them to start at $600. Just one test. You imagine you have access to attorneys, immigration attorneys. You have access to the non-profit organizations. You have access to the real where the immigrants are. You think you won't sell out? As I speak right now, I am the go-to in my community. Every immigrant knows me. They can call me. I solve their problem. The moment you start to put your business as a solution base, you will make money. You got to be able to find the problem and have a strategy. Strategy is what you guys are missing. They gave you certificate, they didn't give you strategy. The certification, yes, is what you would need to do the business, but you have the certificate, you're not using it because you don't have the strategy. They just that's why and that's the pattern. You know how many emails I've been getting every day? You know how many people will come and tell me, I already have this, but I don't make money. Why are you not making money? What is the problem? How can I have such a money sitting down for me? But if I work, I'm going to get those money, right? And that's why I'm putting all of my VIPs to work. We are working to get this money. However much I want to change 2025. I want to make the money because it's sitting there. We just have to keep testing, testing, testing. Because what we do is we want to find out if a child is poisoned. Because you know how many people came to me when they started hearing me talk about lead and they started sharing their testimony that some of their nieces, their nephews died of lead. It's a problem. It's a public health issue. So they need you. Doctor needs you to draw the blood. Doctor needs you to do those ASAP tests, point of care testing for diagnosis. For diagnosis, strep, once you leave strep alone, strep can cause, what can strep cause? Untreated strep can cause arithmetic heart disease. You can cause a lot of things that so unless you by the time you start to understand the importance of what you do, you will see how important and how huge your business has, the value that you bring to the table. So I'm going to teach you all of these things, how to understand your business and how to leverage your business and start to look into for your funds, for the money to help your business grow. As we speak, we have 800 unknocked out tests that we are going to do, and it's just 800. It's not even close to. When we are speaking of statewide, I'm not talking about 800 clients. And I made a caption. Instead of you chasing clients, Let the client chase you. Each time that we have a community outreach, we have close to 200 people lined up, and we make sure we test them same day. You imagine me testing 200 people in a day? Because do you know why they will come? It's part of what we do. Natasha, tell them why would they show up to those places? Put in the chat. Put in the chat. The program has an incentive program. There is an incentive. So every parent will show up. They will bring their children. And that's the formula that I'm going to share with you. You have to be in the room to receive all of these things. And you can't leave the conference and never have a change in your business, because you will be walking out with clarity. Those certificates that you have, a lot of people have clear. Clear is the easiest certificate to obtain. This is the easiest certificate to obtain. AABB certificate is, all the certificate is the easiest thing. And by the time we start to teach you about labs, about government contracts, it will become easy only in this space, only with Coach Eli, because of my newest plug. I'll blow your mind. You will see by the time you come, you will go back home and you'll be grateful that you did, because I will blow your mind. Even me, I didn't know about it. I didn't know about it. Did you see me talk about this thing 3 months ago? No. But my mind was blown, because my business now is, you'll see, I'm going to make my announcement. I just have to receive my award letter before I can run my mouth. But my award letter is coming in less than 2 months. 2 months. Did I say 2 months? I mean 2 weeks. And I'll blow your mind on this newest contract coming up. Then you will know it's a possibility. And you will start to tap into those things. You will start to leave those coaches that just cajole you and lie to you about nonsense. They don't know what they are saying. They just want to make money off you. Yeah, we are making money, but I have to give you value in return, because you're paying for my knowledge. But I'm not about just making money off you because I want to get fed. That's what the other thing people are doing, just taking your money and not giving you something in return. It's not the certificate that you need. How do you use your clear? That's how you're going to learn. That's why I say get your clear before you come to conference. If you don't know how to get clear, let's fill out the application together. We're going to look at your state. All of my students, my private students, all of them have gotten their clear license. For clear anyone, you can get clear. You don't even have to come to me to get clear. But you want to sit in my room though to know how to use your clear. All the problems we are having in this industry is what I want to solve in that one package. That's why it's a 2 days event. That's what conference should be all about. The conference should pasture you, and you should pasture the conference. You must be at the conference. Then the conference you must pasture. You must say, yes, I got this from the conference. This is how I have been benefited from the conference. But you must be there, right? It's a vice versa. It's never a one way. It got to be two way. It got to be 2 ways. You must be like this to receive. But how do you receive? You can't receive if you're like this. You have to receive like this. You have to be receptive. You have to receive AABB certificates, as I was saying. They don't give it to us. DDC don't give it to us. They don't tell us about it. They don't want you to know about it. Because that's how they make money. Let me give you one secret. You guys don't know. You know I'm an immigrant, right? You know I'm from Nigeria, right? Every time any immigrant goes to the embassy, that's if they are coming from the consular. We have something we call consular. If they're coming from abroad outside of America, they must make sure they do DNA testing. It's all politics. All those people that are interviewing back there, they are all white people. They are Americans. They are called ambassador of America. They are the ambassador of America. So they are here, but they work for America. They are ambassador of America. So they will go back to those abroad and be at the embassy. And it's all politics. They must make sure that you pay all these AABB labs. You know how much revenue they make? It's money. They have to make money, and they make it off immigrants. Why? They make it off immigrants? So every time they go for the interview, they won't reject them. They will say, we're going to put your case on a pending until you are able to prove the relationship. How do you prove the relationship? You have to go through this list. So they give them list of places they can come to in America to do the test. And all the results has to come from a lab in America. And only 9 labs are on that list. Endeavor, DDC, And the other ones that I have shot, if you go back to my YouTube, you'll see the names are there because it's only 9 accredited lab, and they give them the list. Your name and my name are not on the list. And each time they come, there is 1,000 each. Go and look at the statistics. In each year, close to 50. I don't even know the number because I'm going to be lying if I say I know the number. And every time they must petition. When they petition, they must prove the relationship. And they've already paid tons of money to get their family back here. And they are now at the embassy again, stopping them to get the visa until they prove the relationship. And they give them a list of labs only here in America. And that's when they come back to us to start to look for DNA immigration. But there is all those labs that are listed. They will never allow you. Your name is not there. But they will pick up the phone and call you for the collection. Only Alliance allows us to resell. That's why I ask you to go partner with Alliance. Alliance is the only lab that allows us to resell, become an immigration agent to sell DNA. That's why you have to obtain the AABB certificate. Without the AABB certificate, you can't do the test. It's illegal. So that's why only Alliance allows us to do this. Then, you then what? Start to market with my formula because I'm the only one that teaches this in this industry because nobody else understands it, so they can't teach it, and it's now untapped. Each one immigration DNA test is 1,000. Nobody will ever teach you because they don't know about it. As a matter of fact, I'm the only immigrant in this space that coaches, right? I don't know if there are other immigrant coaches in this industry. So nobody's going to teach you this subject matter. Only here in CoachEli space. Sorry guys, my phone died. Welcome everybody. Oh my gosh, I'm sorry. My phone died. I use this phone so much. It dies a lot. They're like boom, boom, boom. All right, I'm gonna give you guys some time to join me. Welcome back. Welcome everybody. Welcome, welcome, welcome. Hey, Mr. Gorton. I saw your email. It was so inspiring. I'm sorry you had that experience. But my just 2 cents is hey Alexi, welcome everybody. Welcome back. Good to have you guys here. Honestly, depending on your experience, there is definitely assets or potential with the drug testing. You can definitely do well with the DNA, as I was saying about the immigration, right? You just, once you find those people, you'll be fine. Because immigration also works very well with the word of the mouth. It spreads like that. Again, what are the things we do? We have so many things here that we can honestly offer in this industry. Let me grab me a chair. But so it's conference, Casey. It's gonna be in Atlanta. Its conference is in September the 5th and the 6th. Right now we have early bird tickets for $100, right? If you wait longer than the end of this month, it's gonna go back to 1,000. We are offering payment plan, but honestly, I don't always like to talk about conference because it would look like that's what I want to do, right? That's not the goal for this, honestly. That's not the objective. I know that my conference ticket will sell out for sure because of what it poses, the benefits, the things that nobody is ever going to teach you, that you won't find easily on Google. It's not even on Google because you can't find these people that are coming to Google. You can't network on Google, right? Your network is your net worth. You have to change your mindset. It's a matter of you understanding your power, the asset, your business. Why do you even have LLC in the beginning? Isn't for you to make money. So by the time you start to understand all of this, you will understand that you're in the right place. So we have payment plan, we take planner, we take afterpay. If you don't qualify for those two after payment, you can also reach out to me. I have in-house payment arrangement that you can tap into. You can pay as less or as low as $100 every 2 weeks. We just say as long as you pay it off by the end of June, you'll be fine. But like I said, allow me to continue to empower you, create awareness around the things that you guys don't know. You can even start softly on your own. But like I said, there are so many funds out there that is pumped, ready for healthcare, available rather for healthcare industry. I even know some of you have home care agencies, some of you have group homes. Why do you think nonprofits are always getting money every day for these group homes? It's because again, it's a public health issue because people need health. Why is there a nonprofit? And one of the other things I keep forgetting about the nonprofit side of it. I have a very powerful girl. She's also coming keynote speaker that will be talking about nonprofit, how you can leverage your nonprofit for profit. I know some of you already have this idea. You guys know about the nonprofit side of things and how you can use it for your for-profit business, but you don't exactly know that you can turn government money into daily payment for you, especially in the diagnostic field, right? So we're gonna look at those. I offer classes. Yeah, Casey. So, are you not following me on Facebook? I mean, you can go on my website, officialcoacheli.com, to browse my courses, my training. As I speak, next week, Friday, I have a master class on DNA testing. If you want to learn everything about DNA from start to finish, I'm also going to show you guys how you can look at DNA, how you can offer DNA in all 50 states. Some of you don't know that you can offer DNA in all 50 states. Majority of you don't know that you can stay home and make money offering DNA by just reselling DNA. If you partner with Alliance, you would have access to the database. You will have access to the collection sites in all 50 states, and I'll show you how you can leverage that, how you can sell your services in other states while you're not there. You can even have mobile collectors in all these states and you start selling. It's that lucrative. You just have to be creative and have strategy. Majority of us don't have strategy. We come into this place thinking it's magic. Nothing is ever magical, right? But the moment you have a proven formula, it then turns into magic. Your formula is your magic. It just begins to work in your favor. So please, someone able to pin the thing for her? Let me see. Can I put something in the chat? I don't know if I can chat. So it's official, OFFICIAL, coach, COACHELI.com. I don't think Natasha is here. Natasha, are you please able to pin this website address? Put in a comment. It's officialcoacheli.com. You can also find me. I'm on Facebook. If you go on my page for this YouTube right here, all of this information is on my page. Just click on my picture. It's gonna take you to my page, and you will see all this information there. I have trainings online every now and then. Like the newest training right now is for the master class, and as well as my May cohorts for group training is starting on the 27th. We do mentorship for 5 weeks. But allow me to continue to create awareness around the things that you guys need to be doing to move your business to the next level, right? That's the goal, and that's the reason why I'm here tonight. Like I was saying about the immigration DNA. So yeah, they won't put our names on this list, and they would not even let us know that we can resell immigration DNA, and then we can't do it. Why can't we do it? But moment you know how to properly put yourself on Google, and as well as use your nonprofit organizations, you're gonna sell out. Start looking into those nonprofit organizations. Go to the African stores. There are so many Africans there needing your service. Y'all don't just know, right? But I'll show you all that. I'll show you all that. That's just immigration. That's just immigration. That's just well, I was talking about like so the beautiful part of this space is that there are so many services we can offer. There's so many same individuals, same people that you're already marketing to. You're just gonna leverage it's the wraparound services to the same people. To the same people, right? We talked about lab, we talked about drug testing. Like, let me go back and read Mr. I'm currently a CDL truck driver, so I'm very familiar with the process of drug testing. Exactly, because you guys do. You imagining you as a CDL driver, you already have pool of businesses, pool of friends, pool of colleagues that needs drug testing. And the beautiful part with CDL driving is that it's not just a one-time thing. Sometimes y'all can be randomly tested, right? So you have to truly place your business like that. It's the strategy. Do you have a strategy? What is your strategy? What is your strategy to sell? What is your strategy to sell? For me, my strategy to sell, let me give you my strategy to sell some of my services. My strategy to sell my immigration DNA is I'm an immigrant. I go to the churches. I just put my flyers there. I go to African stores, not just Africans. Hispanic also have their own local shops too. You have to go to those halal markets. You have to go to all this international market. That's where those people are. And you have to promise them, you have to educate them. They don't know that these things are possible with us. You have to promise them fast turnaround time, capture those people, and you will see that you only need to serve one of them and they will definitely come for you. They will help you spread your business right there. You have to capture what else is my strategy with this immigration DNA? And sometimes what happens is that before an immigrant petitions to bring their family to America, they always like to confirm if the child or the family member they want to petition for is related to them. So what they will do is look for a lab, someone like you and I, that is willing to give them the kit to take back to where they are, to their country, to do a non-legal test. Because before they start to pay all this big money to the USCIS to bring these people back to America, they need to know, because there's a lot of money involved. And that's why you see that they don't like to pay these people, and that's why they like to take the boycott the system. They come through the border without a proper documentation. That's why you have a lot of undocumented citizens. And that's where Donald Trump has a problem, because these people are not registered and legally admitted to America. They came through the wrong path. They came as an illegal citizen or illegal immigrant. And that's why every one of them are facing deportation right now. And that's why we say, even as you, now that you are acquainted with the immigration facts, you can even start to offer consultation. If you are able to consult, you know what you're doing correctly. One immigration case is $2,500. And these cases are there. They need your support. Immigration system is a complex system. Why do you pay people to file your taxes? Why do you go to H&R Block? Why do you have someone to file your taxes? Are you saying you don't know how to file taxes? Are you saying you don't know how to put in your name when you go on TurboTax, you don't know how to file taxes? But why do you think tax people they sell out every year and they only do their work for 4 months? Why do you think tax people needs to be paid? Why do you have a tax preparer? Why is tax preparer a job? Why do people do those business for 4 months? Is it making sense? If you understand the why, then you will see why immigration consultation is also needed. Because people don't like to do paperwork. Some things are just complex in some people's mind. I don't pay people to file my taxes. I file my taxes. But some people would rather pay you to file their taxes to get it off their mind. That's the same concept. And with immigration DNA, with immigration consultation, it starts with $2,500 because you're doing the paperwork. You are a document preparer. It's the same thing with tax preparer. Is it making sense? And immigrants will pay you because that's how much it takes to prepare the documents. And you will stack that. It's strategy. You see why I'm saying strategy? Because if you lack the formula, you won't be able to use the formula. It's like you want to solve statistics, you want to solve math. If you don't know the equation, if you don't know the formula, you can't get the answer. So a lot of you don't have the formula. That's where the problem is. You have the answer, you know it looks good. Oh, people are making money, but do you know how? So document preparation for immigrants is a thing and is lucrative. And you are already in the DNA business. You're already doing DNA. But nobody's going to teach you about immigration DNA. Now that you know the secret, all you need is the AABB accreditation. Only Alliance will let you partner with them. And the good thing is that now if you show Alliance my certificates, instead of you paying all this big money, 750, 350, Alliance is only going to charge you 185 to set up your account and give you the portal that I wanted to show you how you can use the portal to in all 50 states. And on top of that, you will get the AABB certificate and you will be able to do immigration DNA. And by the time you're doing immigration DNA, you are talking to immigrants. Then you will start to sell your immigration consultation, because then they will want to consult with you. Oh, can you help me? My mom is in Nigeria. Oh, my friend is in Albuquerque. Can you help me bring them here? Okay, let's put their paperwork together. Then from one same client that came for DNA, you will charge them 2,500. You see how you're gonna leverage. You see how you have to do it? That's the formula. That's how you're gonna sell your services. It's gonna come through dedication, but it will happen. It's not overnight. By the time you understand this in 2 3 months, 4 months, 6 months, the max, your business will start to take shape because you have been working on it prevalently for 6 months. You understand it, then it will just speak. It's like an airplane. When an airplane takes off, it's still like this, but when it gets to its altitude, whatever those things are, then they're stable. Then until they are ready to land. So in the beginning, you have to use the formula, keep it, and start using it, and be consistent. Then you understand what we're talking about here. So multiple services. But I always like for my students not to do everything, because sometimes you guys are going to be distracted. I'm going to be distracted. So let me go back to the conference. Yeah, I can't wait to see Mr. Gordon. So 4 days, because I know you reached out to me. I was just trying to see what I can help you with. But with the CDL, I don't know. You know that on DOT website, they list, is it true? Confirm if what I'm saying is correct. Let me know, Mr. Gordon, Mr. Collins. On the DOT website, there is a place we can access the new businesses that just obtained their authority. True or false? Put in the chat. Let me see if what I said is true or not. DOT will display or compile a list of new CDL trucking companies, owner, operator, that's recently just got their authority. True or false? If the answer is yes, then isn't that how you guys can fetch or create lists? Because we know that every trucking company needs drug testing. Advocate for drug. Haha, I like it. Advocate for drug. The solution is that. Now you're thinking like a solutionist. Now you're ready to make money. That is what sets you apart. You see the verbiage? You see how you said it differently? Do you think if you put this in front of the people that have the money to give you, you think they won't buy you? They will, because you're advocating for drug abuse. It's a problem. Substance abuse is a problem. People are dying from overdose. Why do you think Narcan is selling out? Why do you think this mental health clinic are selling out? Drug is a problem. And mental health and drug is comorbidity. It's called dual diagnosis. Everybody with mental health issue, 90% of them have drug issues. They're addicts. Opioid, street medicine, fentanyl, all these things that we test for anyway. So you are going to advocate against drug and abuse, against opioid, against addiction. And you can partner with the right people and they will buy from you because you're helping them solve the problem of addiction, of overdose. Because you know how many people die from overdose? You know how many people are already, they are dying. Drug and abuse is an issue. It's a public health issue. That's actually what I teach at the university. That is actually, I don't know why I forgot about it. I'm so fixated on lead and STD. Drug is actually where I come in. I used to be a case manager at our university. And we were using buprenorphine, Suboxone to treat addicts. A majority of them, we refer them for mental health. Safety, while 247 on call, mobile testing services, that's, and you think you won't sell out with this strategy. That's what we are saying. That's how you continue to educate yourself. That's exactly the formula right there. That's the thing. I like, see, position yourself for that drug advocacy. That's it right there. That's how we're gonna work in 2025. And guess what? The DEA has funds, money, looking for people that will help them with drug testing and their employee, because all of their employees, so not only workplace drug testing, they also need for this SUD problem, community outreach for drug testing and advocacy. DEA has there is an RFP right now. They are looking, nobody is looking there, nobody is tapping into it, because nobody is, who is doing lab tests, who is doing drug testing? Us. And we that we are the us, we don't look at it, we don't go there, we don't fulfill those things, because we're not, nobody's training us to do it that way. So there is actually a program, there is actually money right now sitting there for you to go tap into for drug testing. So educate them while adding value. Education and value. Education. You can, even what you would do right now, you're going to go on Google, go on every platform to look at for event. You're going to go look for event, hiring events. All these warehouses, they be hiring multiple hires. You're going to go to those events and capture the hiring manager. You want to know which company does drug testing for onboarding. You have to pretend that you're looking for a job and go to the hiring event and go sit there. You have access to where you're going to be in the right room, because then it's an event, so multiple companies are there. You get to network and get to know the actual people that are doing this hiring and boarding, and you get to interview them to see, do they even do drug testing for employment as a pre-employment requirement. And that's how you're going to get all these answers to your problems. That's exactly, these are some of my blueprints that I'm dropping here. But if you need more blueprints, we're going to have to meet at the conference. My eyes are closing now. It's 11 a.m. already. You have a good strategy. You have a very good strategy. And you can add DNA to what you do. Or just stick to your plan. Miss Alice, let's go. I'm so tired. But that's how we're going to roll in 2025, guys. There are so many funds out there. They need our support. They need our help. Lab has money. Drug testing has money. The only people that don't have money is DNA. But immigrants will put money on your table for DNA. Unless if you take your business to the courthouses. One of my students gave us a strategy for that. You see those brochures, those pamphlets? You're going to strategically go put it at the court's house. Oh no, you're going to go to WIC. And you're going to go to family and family services department, family and health department, human services. Because you know where you go for interview for your child support, and where you go for interview for when you apply to SNAP, like food stamps, right? Those offices, you're going to go and put your flyer, your brochure, and walk in and talk to one of them. They need it. They may feel reluctant in the beginning. Just leave them with your information. They will call you. Being a solution provider, I can help you. We can help you. You guys are facing this. That's the thing. That's the word. That's the pitch. That's what you should caption on your flyer. That's what the first thing we see when we go on your website is that solution. If you don't know how, put it on ChatGPT. ChatGPT is free. Put it there. ChatGPT would even ask you, should we use this? Should I come up with a landing page caption? Do you need this for a flyer? Tell ChatGPT to give you, just put it in ChatGPT. Give me solution script for drug testing. It's gonna give it to you. And the moment you open your mouth, when you're doing your lunch and learn, when you're meeting with your prospective client, that's what you want to preach. All the staffing agencies, they are staffing every day. They can't staff all because they also have contract with these nursing homes, with the healthcare system, right? Healthcare staffing, and they can't put an employee at those places unless they prove that they've been drug tested, they've been background checked. Isn't that why background checks are needed? And they need, staffing agencies don't do drug testing. They need you to do drug testing. You just need to partner with them. I have a contract with a staffing agency, a security company, and a trucking company. They need your help. The moment you are providing solution to them the way that you say it, they will sign, and your fees are reasonable. And all of your clients, there's people, they will send them to you, or you, they ask you to come. If you're mobile, you go meet, you find an arrangement, and you do this business. And on top of that, like I said, so instead of you guys working hard and looking for individual clients, you would just turn this money, you already have the community to serve, because that's how government funds work. You got to serve the community at a larger capacity, right? Is the capacity that we're looking at here. Yes, sir. That's it. That's how we roll. All right. Let me know. Did you get this? What was the name again? Casey. Casey, you got it right. So Casey, you got the website. Alice, I'll see you. I can't wait to see you guys. You know, invest. I want to see you. I do truly want to see you guys. I truly want to see you guys. I want you guys to be at the conference. Okay, I'm gonna go. I will return again. Make sure you're following me. I'm on Facebook, I'm on Instagram, but I'm very heavy on Facebook. I have a group in Facebook as well. So you might want to join and stay in the network and see what's up with what we do. Yeah, thank you all so much for that was you, right? Yes, information transformation. Yeah, I'm above for transformation. We got to change our lives. We can't keep deceiving ourselves. We have to really, really. A lot of us are burned out. Who wants to work for people every day, 9 to 5? Like, who wants to do that? When my business can be potential to me, I want to run my business. I want to run the show. Oh, on top of where we don't have any more VIP tickets, I was gonna say the VIPs are getting some few things. But I'll show you exactly how you can get your lead in your states. Okay. All right. I'll see you guys in the group. Bye. Let's stop this.